Hello, welcome, and thank you for joining us for our panel, Capacity from Within, Building Bridges for Innovative Evidence-Informed Decisions. We're very sorry for the delay. We were having some technical difficulties and are still waiting for one of our speakers to join us, but we will start in the meantime. So thank you very much for being here. My name is Slavina, and over the past year and a half, I've had the opportunity to work as a researcher and senior data analytics advisor, and now as director of the data science unit in the government of Manitoba. As a sociologist interested in decision-making and policy development, I have been privileged to gain an insider lens into the context of decision-making in government and how data and evidence are, or in some cases might not be, drawn on to drive and inform this process. The current context surrounding the COVID-19 pandemic has shown how, in moments of uncertainty, when governments are grappling with decisions that do not have clear precedents, science and evidence can become an anchor for decision makers. However, public health decisions in the context of COVID-19 represent only a small part of the decisions made by government. How do we know if a social program is working? What are the expected benefits or implications of remote work arrangements on mental health and productivity? Every issue, from the timing of traffic lights to the substance and structure of social programs or the implications of HR decisions, require accurate data and evidence. Fortunately, the data and evidence needed to support these decisions exists and is available. In the last 10 years, we have seen an explosion in both the variety and amount of data and data analytics capability available to researchers and governments. However, bringing scientific evidence to bear on daily decision-making in government remains a challenge for a number of interconnected reasons. These reasons can loosely be summarized as issues relating to capacity, process, and silos. In terms of capacity, traditionally, many sectors within government have worked with academics or the private sector to fill many of their needs for evidence and evaluation. This division of labor has contributed to a scenario in which government decision makers and analysts are accustomed to thinking through complex policy issues and challenges, but not necessarily to translating these issues into questions that can be answered with available data, or to completing the more technical aspects of the data analytics work needed to answer these questions. In terms of process, translating data or evidence coming from academia or other sectors and bringing this evidence into the decision-making process comes with challenges. Academic research is not always produced in a way that makes it intuitively applicable to the decision-making process in government. Academic questions are not always directly driven by policy issues or implications, and distilling and translating important findings for policy development and decision-making can be challenging. Furthermore, policymaking and academia can be understood as different spheres that operate with different timelines, linguistic norms, and general priorities. This is why bridging academia and public policy and issues of knowledge translation have become focal points in conversations around evidence-based decision-making. Finally, in terms of silos, despite the growing size, richness, and diversity of data resources available, these resources often remain siloed or contained within departments or sectors, impeding fluid cross-sectoral collaboration. The public sector produces immense amounts of data as a product of daily operations and service delivery. For instance, provincial governments have access to data touching on health, education, use of social services, justice involvement, and so on. While this data holds crucial information for understanding diverse issues such as social inequality at the population level, too often these resources are not taken advantage of to build better policy and improve the lives of citizens because they are siloed within departments and can't be linked together to tell a cohesive narrative. Silos exist across sectors as well. Academia and the private sector have data and capacity that would be invaluable for decision makers in government and vice versa, but silos continue to impede cross-sectoral collaboration. Despite these challenges, innovative solutions for incorporating evidence into decision-making are being developed across various sectors in government, academia, and private enterprise. Today, I am honored to introduce our esteemed panelists and invite them to discuss the solutions that their organizations have developed to bring evidence into decision-making. These solutions include programs designed to integrate early career academics directly into the policy decision-making arena, examples of collaboration and data sharing across private and public sectors, and examples of programs that support cross-sectoral research and collaboration. Joseph Bettridge is the practice lead for the TELUS Insights Group, which works to help governments and private organizations leverage big data and analytics to achieve policy and business goals. In the context of the COVID-19 pandemic and TELUS's Data for Good initiative, Mr. Bettridge worked to help partners leverage telecommunications data to make evidence-informed decisions to contain the spread of COVID-19. Mr. Bettridge has worked with world-leading experts on privacy to build products that facilitate cross-sectoral collaboration and data sharing while preserving anonymity. Victoria Schuckel is the Executive Director of Research and Innovation in British Columbia's Ministry of Health. As Executive Director, Ms. Schuckel supports diverse capacity-building initiatives and collaborations between the BC Ministry of Health and external research units and funders. She manages the ministry's health technology review process and is providing leadership on a series of research projects meant to support the successful implementation of primary and community care transformation. Finally, Deputy Minister Sinclair, who we are still unfortunately waiting to join us, is the Deputy Minister of Central Services in the Government of Manitoba, where he has held numerous senior roles, including as Deputy Minister of Crown Services. Deputy Minister Sinclair is a champion of evidence-based decision-making and has spearheaded and championed Manitoba's data analytics strategy, including the creation of a new centralized data science unit, whose mandates include inserting data and evidence directly into the policy development and decision-making process and building capacity for data analytics within government. Before we hear from our speakers, I invite the audience members to reflect on the following 3 questions. Please keep these questions in mind as we listen to our speakers and consider how some of the solutions and challenges they discuss might apply to the context of your own institutions or teams. After hearing from our panelists, I will invite you to engage in a discussion with our speakers to work through ideas that can be applied to the challenges you have observed in your own or other institutions. And I will give you a few minutes to reflect on these. Discussion. Each of your organizations has developed innovative solutions to bridge science or knowledge production with practical evidence-based decision-making. Can you please describe one or more of these solutions, taking us through how they were developed and what you see as the main benefits or successes? We will start with Ms. Schuckel, followed by Mr. Bettridge, and concluding with Deputy Minister Sinclair.
Good morning. You can hear me? Good morning. It's a pleasure to be here. As Anna indicated in the introduction, I'm from the Ministry of Health, responsible for research and innovation. And over the last close to 20 years, I have been involved. I've had the opportunity to be involved in a range of programs and strategies to integrate research into policy and planning. And those have included things like embedding researchers, working with research networks, hosting monthly symposia with researchers for close to over 20 years. That's been going on in the Ministry of Health through a capacity we have at the ministry to rapidly commission evidence syntheses. Sorry, I'll just move this here. To fund seed grants with post-secondary institutes, and to actively engage in a range of initiatives that are funded by the Canadian Institutes for Health Research. All of these meant to increase decision makers' access to evidence. So it's within that context that I have identified a couple areas that I am quite enthusiastic about. Because while I would say that we've had this broad experience observing, testing different methods for working with researchers and integrating data, and we've had a chance to see which ones are successful and which ones aren't. These ones I think are going to be probably game changers. I was going to provide two examples, but I think because we're still waiting for Dept, I'm going to be really quick, but I'm going to provide three quick examples of areas where I think that there's exciting promise. One of them relates to data, and that is just the infrastructure that's in place in BC that we're building is an integrated health data environment. And it's not exclusively health. It also is connecting to Crown data, which means the social, education, income, other kinds of data. That's going to be a game changer in British Columbia because we, as was described in the introduction, there's a lot of siloed data, and the ability to actually look at citizens' services and interactions across the system will enable a much deeper understanding of where programs are being effective and where they're not. So that's one, and I just want to touch on that because I know that Rob is going to be talking more about data. So I just want to flag that one from a data analytics, and that has some pretty significant implications for the research community and for our interactions with the research community, because the ministry is actually building a capacity that never existed previously, and we were historically dependent on the health services and policy research community to provide some of the information that the ministry will now be able to generate, some of it. But the two examples that I wanted to describe that I see as really positive directions that we are headed are, one of them is related to primary and community care. The other one is related to COVID, and I'm going to talk about the COVID one first. I'm just going to be really quick. So basically, in British Columbia, like other places, we were the beneficiaries of a lot of research funding and a lot of research activity related to COVID. The challenge for us was, how do we actually organize and coordinate all this activity? There are in British Columbia currently about 400 COVID-related research projects. There are over 125 COVID-related surveys that have been conducted or are being conducted with the BC population or subpopulations. And so the work of trying to support a provincially coordinated research response to COVID has been much more about a knowledge translation, a grand knowledge translation, opportunity and challenge. And what the province put in place to address this was a strategic research advisory committee to essentially to coordinate and to provide advice to our provincial health officer, Dr. Bonnie Henry, and to provide advice to those responsible for the provincial coordination of all planning and resources related to COVID. One of the activities that I would highlight, so yes, we have these 400, we created a searchable database. We went through a research priority setting process. We mapped all the priorities that the Ministry of Health had identified against the 400 projects to first determine what was already happening, who was doing what, and where and how could we plug in decision makers with some of the researchers who'd been funded either through provincial funding organizations, the Michael Smith Foundation for Health Research or Genome BC, or with external funders, federal or international funders. That was the first place to basically map and make sure that we were taking advantage of research that was available. The second thing was that an external group of researchers from all four pillars in health research, biomedical, clinical, health services, and population health, and some key people were brought together as an advisory committee to develop an adaptive research framework. And the intent of that was to basically identify what are the priorities that are needed that need to be addressed in the next 6 months, 12 months, and to help basically focus where the gaps were and where both researchers and the decision makers could look to inform and to basically take action on that, whether the decision makers wanted to fund it or the researchers wanted to apply for grants in those areas. Okay, so that was just a high level. So a COVID, basically provincially coordinating the COVID research response. And then the second example that I'm going to speak more about in the next sections of this panel is that I think increasingly in the Ministry of Health, we are recognizing the critical importance of rapid learning cycles. And this is adopting agile type practices and applying them in research and trying to address the information data needs of decision makers. The environment is moving so fast, things are changing, that we have had the experience of working with a UBC, University of British Columbia-based research group who are conducting rapid learning cycles, which are in 8 to 10 weeks. And the intent of that is that they find out from the ministry. Sorry, I turned everything off. Sorry. With the ministry to identify what are the emerging important questions facing the ministry, and to essentially conduct a series of interviews, pull information, identify jurisdictional frameworks that may have relevance, pull this together, and have a workshop with the ministry to basically support the ministry's identify decisions that need to be made within a period of time. That's a really compressed version, but I guess in the example that I just showed, it's not your classic research. It's definitely blurring lines in health of research, evaluation, quality improvement, and that is the reality for the Ministry of Health. In some cases, it's not simply how do we take research findings and bring them into our environment. In many cases, it's great when it's as easy as that, and sometimes it is. But because of some contextual factors, there often is required and changing, and things that are changing, and organizational priorities that are shifting, and a variety of different things that are happening. The need to assess not just empirical data, but to be also integrating what are people who are on the ground, direct service providers, users, different administrators in the health authorities here in British Columbia. What are some of the issues? What are some of the questions that they're having? And all of that needing to come together to be part of the information that's provided to the Ministry of Health. I'll wrap it off. I'll just stop there. But so just to recap, the three examples were a provincial health data platform, a coordinated provincial research response for COVID, and a shift to more rapid learning cycles. I see definitely the trend in the Ministry of Health. Thank you.
Thank you very much, Victoria. Joe, would you like to comment now?
Yeah, absolutely. So being in the private sector, we've kind of approached this from a very different angle. So about 5 years ago, TELUS went on a journey trying to figure out how we could provide information and data that we have as a telecom carrier out to governments and private sector companies to help them answer questions they may have around what's happening in the real world. One of the primary data sets that we have as a telecom that can be useful for this is location data. We've built up a mass amount of location data using our cellular network. And we use this to solve questions around human mobility en masse. So really trying to understand where people go, how they go, what they're doing in large aggregate groups. With this, one of the key things we realized very early on is that privacy is going to be one of the most important pillars of what we build if we're wanting it to go into government research opportunities and to help inform policy. How we figured that out was through interviews with users in the government, trying to understand what different ministries and different organizations really needed to have a data set that they could use. And privacy was continuously something that came back to us. So we listened to that market messaging and developed a privacy preserving program around this type of data, so that we could offer out insights and information to government organizations to help them influence policy, where the privacy of the users that information is built on is preserved and the end users are getting relative information that is not going to interfere with the privacy of the individual. So we started that out about 5 years ago. And as we've developed this program, we've come to the conclusion that there's a lot that can be done with this type of data, and we can continue to grow it to solve new problems. And a good example of that is when COVID struck in March, when we started really seeing case numbers rise. We started building a new program called Data for Good, and the TELUS Data for Good program offered government and research bodies access to this type of data, this de-identified aggregate location data, in a way that would allow for these groups to use this data to solve problems around COVID specifically. So we use, as Victoria was speaking about, kind of rapid prototyping and rapid decision making to build out a platform that these researchers could use to try to help solve problems around COVID. One of the things we realized with COVID is no one on my team are experts on epidemiology or disease tracking or any of these types of things that are very important to making decisions right now. So we need to lean on experts in those areas and use our expertise in location and privacy to provide them with the information they could use to make informed decision making. So really that collaboration and working closely with the customer to understand what they need and to understand what is really necessary is critical in understanding the problem and building out something that can solve for that problem. Our Data for Good program has actually gone on to win the IAPP, which is the International Association of Privacy Professional, their award for Innovation of the Year. So the TELUS Insights Data for Good program has won this award for being innovative in privacy and in its rapid response to COVID-19. By doing this, we've really shown that we're taking a forefront in privacy, and we feel that is the right way of approaching government decision making. And we want to continue to evolve this to solve new needs that governments may have. And we really see the government customers as a really critical group in giving information to help inform decision making. So I'll pass that back over to you, Anna.
Thank you very much, Joe. So I'm going to move us on to the next theme of discussion, and then hopefully, after we have an opportunity to kind of cycle through and discuss. Hopefully, Deputy Minister Sinclair will have been able to join us and then maybe speak to all the themes at once. So I'm going to move on to the next one. And if he's not able to join us, then I can maybe speak to some of the interesting things that we've been working on at the Government of Manitoba. But for now, we'll move on. So all of you have mentioned some really exciting initiatives and opportunities that your organizations have been working on to help bridge data and decision-making, but I wonder if you can also take us through some challenges that you have potentially encountered in trying to implement these solutions. And we'll start with Mr. Bettridge this time and then move on to Ms. Schuckel.
Okay, thank you for that, Anna. So one of the early challenges we faced, I kind of talked to a little bit earlier, was trying to get the market aware of privacy preservation within location data. Today, our government does not have very strong policies towards privacy around location data. There's very good policy around health data. There's very good policy around things like Canadian anti-spam law towards how to use email for marketing, but there isn't very strong policy towards location itself, which is the data set we were primarily working with. So we had to work a lot with leading experts in the field to try to understand what we could and couldn't do, what would be appropriate, and how would you actually preserve privacy on these types of data sets. And that led to a very difficult first year or so of trying to figure out how to do this. So we worked primarily with Anne Kavukian to begin with, who's the former Privacy Commissioner of Ontario. And she has a program called Privacy by Design. So we worked with that program to build out a set of policies and constraints to preserve privacy within our data set. But while we were doing research on that, we actually realized there's another camp within the privacy area, which is where differential privacy comes from. And we realized that they felt there's more that was needed from a more mathematical perspective when dealing with privacy on things like location data. So we had to find experts in that area, and we ended up working with Yves Alexandre de Montjoy, who's one of the key researchers in the area of differential privacy, in building out some more mathematical approaches to privacy to layer in with those policy approaches. And this really allowed us to build out a program that was really well built towards privacy and ensured that both different ways of approaching privacy were addressed within the program. As we kind of moved from that and started launching this product, one of the first challenges we ran into is that when people are presented with information and evidence, they often don't believe it unless it matches what they believe to be true. And this is a very bizarre human behavior thing, but we could give you information saying, let's say there were 10,000 cell phones at this event, and someone will say, I'm sorry, we only think there were 5,000 people there. Because we've counted historically, and we do a count every hour, and we walk in and we have someone walk through the crowd and count people, and they came out to 5,000 unique people they counted on the ground. And having this challenge of evidence not matching previously conceived evidence or previously viewed ways of looking at data has become a constant challenge that we've looked to overcome. And a lot of what you have to do with that is set the context of the evidence you're presenting. So you can't just present this as an absolute truth. You have to present it within the constraints of what it is. So you have to talk about the methodology for collection, how this evidence was created and generated. What are the gaps in that evidence that can be presented within the data? Where are there room for error, and where is there not room for error within what you're presenting? And by presenting that holistic picture, it allows people to absorb that evidence better and understand where it fits in the bigger picture of the decision they're trying to make. So as we were developing this program at the beginning, we were not very good at this, and we've gotten better and better at understanding how to present this evidence within a strategic context and understand the context of how the data we're building with and working with gets presented. But I think that practice can be taken outside of just what we're doing and taken to a more general sense of how evidence is looked at in decision making. You have to look at the evidence in the context that it's collected and the context that it's generated. We as a society have grown to have so much more data than we ever did, even looking 5 years ago, 7 years ago. The amount of data available to us was minimal compared to what it is today. It's evolving at an exponential scale. But all that evidence and all that data we're generating, it is only true within a context. And if you don't present that information with that context, it becomes very difficult for decision makers and policymakers to actually incorporate that evidence into their decision or into their policy making. So I think those are the key challenges I kind of wanted to address. So I'll pass that back over to you, Anna.
Thank you very much, Joe. Victoria, would you like to comment?
I think you're on mute, Victoria.
Oh,
sorry. You're back off mute now.
Okay, thanks. I think, Joe, you said one of the most important things that I think for anybody who's participating in this seminar who either has struggled with trying to get evidence translated or is new and as a newer researcher wondering like what that experience is going to be like, I think you totally nailed it with your comment that that people come with a lot of perceptions, but they also have with their own view of the system or the problem or the places they touch and their experience and their interest and receptivity to evidence is very much shaped by the world as they understand it or the problems in the system as they experience them. And it's hugely so. I'd say that the 20 years that I've been involved in different kinds of activities connecting researchers and policymakers and through, as I said at the beginning, I just listed a few of the examples, but we have dozens and dozens and dozens of research projects that we've been involved in, or different experiences, and I would say that it comes down to that fundamentally. The challenge is that people don't refuse to take up evidence in some cases, or at least in my experience. I know that there are other venues where they just politically disagree with the truth of the evidence, and we're not talking about that. What happens in the environment that I'm familiar with is that people are incredibly busy. They have, unless they're trying to answer the question that the research is specifically seeking to answer, it can be, then that can be easy. That can be straightforward and great. A connection is made. But in many cases where you're trying to introduce evidence into something that's in motion or is not immediately required, it can be extremely difficult because different people are very busy and they're working at, like I said, in different places in the system. And whether they're trained in sociology or psychology or in data sciences or public administration or some other field will in some ways shape how they view the evidence. And there are some people, they need to see business case analyses, and there's some people who need to see business case analyses and they need to understand user experience data, and they need to see, anyhow, there's a whole range of different kinds of information and data to bring to a decision, and people come with very different expectations. And that's really hard to systematize an approach when it ends up being, in many cases, a very human kind of process. And you can't, and so it's great, we need to figure out and enrich our approach, which addresses the human dimension of trying to support uptake of evidence and understanding of the implications of data. Again, as a system, we need to figure out ways to create a culture and a process that is less fragile and less dependent on individuals. But I would say when you look across an organization, you can generally map, these are areas where there's a high interest and level of receptivity to research and to evidence, and there are other places where it isn't.
Thank you very much to both of you. We'll try to give the deputy one last opportunity to potentially join us. So perhaps now we can talk with a view to the future. So obviously, there are incredible work being done, and challenges remain. So I would pose to our panelists then the following question: what do you believe needs to happen in the next 5 to 10 years in order to continue to move the needle in the right direction and continue to realize, the potential for really integrating science and evidence into daily government decision making? We will start with Ms. Schuckel, followed by Mr. Bettridge.
Hopefully followed by the deputy. So these are I have, I think, five things that I think over the next 5 to 10 years will need to be in place. So, or 10 to, was it 10? 5 to 10, yeah. So one of them is when we talk about what was referenced in the previous comments about people, some of it relates to trust. And I think that I'm riffing here, this is not in my notes, but what we're seeing in parts of the world where there's a lot of a spotlight on science right now with COVID, and there is an amazing opportunity to highlight the strength of and the importance of science. And we also know that there are counterfactions that aren't necessarily trusting of science. And there are certain things within the scientific paradigm that often ends up with more research needed. What I would say is needed in the future is for the Ministry of Health anyhow, I would love to see a rolling 3-year research agenda in all the different areas of program areas, with an expectation that that would need to be updated on an annual basis, and that would be integrated into regular business planning. Now, that would be, as you got better and better at it, you would quickly see that you can't just have pharmaceutical services division, you can't have primary care division doing this independently. It would need to eventually be integrated at a higher level. But the importance of program areas identifying what they believe their research agendas should be is critically important to just acknowledging where some of the key information gaps are. And we know, certainly COVID has underscored incredibly, that yeah, you can plan all you like and then things are going to emerge and you're going to need to just have to figure out how to respond. But I think the discipline of engaging in research priority setting is an important activity that needs to be built into what's happening in the public service. I think that the government will be driven by government priorities. And, in the case of health, it's about how do we take this old system and try and innovate, and recognizing that we consume about nearly 50% of the provincial budget. How can we make healthcare better, safer, more accessible, address inequities across the population? And can we do this, and can we innovate so that we're not, necessarily providing 1950s style models of care, where in some cases we are. So I think that the reason that I was saying that is because the ministry we need to have a research priority setting process that involves other people, that's not just defined by the ministry, that has the opportunity for researchers and for people who are impacted by the healthcare system, the users, communities, to also have an opportunity to review that and to comment on it. So I think there's a degree of co-development. That said, there will always be a heavy hand that government will play, because there will be crises that are visible to the public, and we're in a 4-year electoral cycle, and government is responsive to concerns and crises as they emerge. And so there is this balance. So I don't want to be unrealistic and say, let's have a fully consultative, fully collaborative process. I do think we actually need to have a collaborative process, because I think that there are opportunities, whether you're talking about surgical services or primary care or mental health and addictions, there are opportunities for the public and for people who don't necessarily get to sit at tables where research priorities are defined to be part of the conversation. Ultimately, government will decide as they do. Another thing that I would like to see, and I think it's going to have to change, is that where there is the opportunity to have a conversation among a research group that's embarking on a major study. You can't do this for every study that happens because the volume is just too great, and people in ministries and health authorities don't have the bandwidth to actually connect with all researchers. But we've seen this before, we've done it before, and the researchers basically, they were looking at what would, in this example, it was, what would be the costs and benefits if the province introduced free contraception and long-acting contraception, not just free condoms or something, so the research group met with people from Pharmaceutical Services Division, finance, a range of different areas, acute care services, physician services, And basically the question was, what information, what data would you need to make a decision? If we're going to simulate different policy options and talk about, like, obviously, so cost is one of the data, but and they talked population and public health, having those conversations up front and having a clearer understanding about what data, what kind of evidence do people actually need in order to make an informed decision? And again, not just talking to a single knowledge user, but talking more broadly. I honestly think that's going to help a lot. We know that Canada is often referred to, and perhaps other jurisdictions are as well, as a nation of pilot projects. And we grapple with this question about how do we scale and spread? How, when we've got a single community or a single program that is doing amazing things, how do we scale that up and spread it? And I do think that when we're talking about evaluating that highly successful project, what we may be doing more in the future is talking to other people where we want to scale and spread it and asking them, so what evidence do you need to feel comfortable with this being implemented in your community or in your region? And it's not something that we've typically done. We've basically had a project, done an evaluation, and then decried the fact that people never implement it anywhere else because they didn't do it first. So that's the second thing. So an upfront approach to identifying what kinds of evidence people would need. The third thing, as I said before, is I think we're going to need to have a lot more rapid cycle processes built into research projects, or that they're not even the research projects, they're where academically trained researchers are able to engage in this not conventional researchy way to basically come in agnostically to an issue and say, what are the kinds of questions that you are seeking to answer, and when do you need it? And then to using, like I said, talking to the people who are going to be affected, pulling together, so qualitative, a mixed method approach, and then pulling in data that is relevant, pulling in other frameworks it's the work that happens it is work that typically happens that people in policy do. This is what we do. I'd say, so the reason I guess we wouldn't do that and we might work with academic partners, or why we have in the ministry, is because, well, I can say that some of the things that they've brought, and I'm trying not to do like product placement. It's the Innovation Support Unit, UBC, who we've worked with. I'd say that some of the strengths that they brought to it was just the rapidity that they could, the speed with which they could pull in some of the research and some of their connections. The person who leads that project is a physician and also has a PhD in health informatics, and his visualization, their capacity to do visualization of both data and just thematic, their thematic analysis and being able to visually represent that has been really impressive. And I think that has also helped a lot. And then the last one I was going to say is actually about data visualization. So I already kind of spoke to that. I guess I just wanted, so data visualization, that one probably, Rob may say more about that. Sorry. Because I think that people learn in different kinds of ways, and the example of the cell phones, I think, yeah, I'm sure there's, if I thought more about it, I'm sure that there would be a way to, I'm sure there's an explanation for why there were 10,000 versus what people perceive that there should only be 5,000. So data visualization, I think that's going to, and then I just want to underscore that in my experience, people don't not use evidence because for any malicious or ignorant reason. my experience, even working closely with the team that's doing these rapid learning cycles, it's shocked me the pace that the people in the ministry and the people in the field who are working on primary and community care transformation, how quickly things are changing, how the public commitments by our minister to achieve certain targets are driving a lot of activity, and people's capacity to slow down and determine how they can integrate these other kinds of findings is not nearly as straightforward. I'm going to wrap it up there because I see we're joined by the deputy.
Yes, thank you so much, Victoria, and welcome, Deputy Minister Sinclair. I'm so glad that you're able to join us, and I'm sorry.
Sorry, that was an effort that I don't want to go through again.
Yeah, so I'm going to open the stage to you, Deputy Minister Sinclair, to talk through some of the solutions that have been implemented in Manitoba, some challenges that you see that remain, and perhaps some notes about the future of where you believe this initiative needs to go in order to really integrate science and evidence into decision making.
Thanks, appreciate that. And sorry, I didn't mean to come in late and interrupt you, Victoria. I mean, you're actually on a train of thought that I was thinking, was hearing and saying, yeah, that's exactly one of the challenges we have around visualization and how people consume data, which is, I think, a big challenge that we're having. Just having the ability to understand, consume, and then translate it into decision making is a huge challenge. But so just to Anna's setting the stage for me in terms of what I want to speak to. So Manitoba's been working on a data science program for quite some time. I've been involved with it in some shape or form for about 6 or 7 years now. Going back to when I was involved with income assistance areas and trying to understand how and why people come in contact with income assistance and how you can move them off and what are some of the characteristics around that. And since day one, despite the fact that in Manitoba we have very rich access to data, and I'm not sure how many people in the conference are aware of the Manitoba Centre for Health Policy, but Manitoba has a individual record level micro data linked data set. It's got 95 or so linked data sets from the healthcare system, the justice system, the education system, the welfare system, including income assistance and child welfare. But we haven't really found a great way to use it, work with it outside of a almost purely academic environment. So, which resulted in sort of long turnarounds. So, and again, apologies for dialing in late, but I was hearing Victoria talk a lot about rapid turnaround and doing things quickly. We were getting evidence back or information back that was on 2-year-old lag data, and then it was 2 years after that by the time what we refer to as deliverable is ultimately delivered. And by that time, not only would the policy challenge change, the government had changed, the priorities had changed. It was just simply too late to actually consume or make use of any of that evidence. And that actually led to a narrative in Manitoba that data wasn't useful, which was really unfortunate, is because people weren't seeing the reasons why it wasn't being used, as opposed to just a broad brush, which is it's not useful, it doesn't work, it doesn't help us. So we shifted with the Centre for Health Policy to something referred to as quick turnaround. We was trying to turn around projects and information much quicker. So instead of working through an academic setting with all of the I was going to use the word challenges, but that's not a fair word. With all of the realities of an academic environment, ethics, approval, publishing, peer review, all those kinds of things, we just went more straight to let's access the data and have Manitoba actually do the work, which resulted in a different approach to getting access to the data. And I think it was beginning to position information much quicker, much more relevant. But we came up against a new problem, which was we didn't have enough of a capacity within government to actually do the data science. We had lots of people that would like to claim themselves to be data scientists or said they had experience in data, but it was really descriptive in nature and wasn't the predictive type information the government really needed in order to make stronger decisions. So that became a new challenge or a new barrier. All still operating under that same sort of glass ceiling of decision makers not knowing how to consume data. Was it accessible? Was it consumable? Was it usable in terms of the policy development or program development or policy review, program review cycle. So we've now shifted towards, bringing in staff that are building a focused data science capacity. So we're still in early days of that, but I think we're getting some really good wins. Interestingly, in the current COVID environment, I don't know how much Anna spoke to this. We've sort of shifted a little bit away from just relying on our own administrative data to actually looking at external data that's either open sourced or open to us through other various means. So whether that's cell phone data, app data like OpenTable, data through Moneris transactions, and trying to build much more of a rich data set. Still lots of challenges, still lots of things to address in terms of capacity to produce, capacity to consume, and just the underlying technology framework to be able to sort of combine all this and provide access to it at any kind of scale. But I think the moral of the story, and I do apologize, I'm rushing through, recognizing I came in late, so if anybody has any questions, please ask after the fact. But I think the moral of the story is we're starting to make some really solid inroads. Senior decision makers are now starting to point to, we have the data, what does it say? We should be listening to this information, what does it say? So we're starting to make some positive inroads, not without some challenges. And I think we've butted up against some other issues where even some of my deputy minister colleagues will call into question the validity of the information. People still spend more time looking for all the reasons why the data is wrong as opposed to understanding why it's right and how it can help. I sort of coined the phrase, we're sort of, even though we have a government that's very evidence oriented, publicly has said that they want evidence to drive decisions. We have a public service that is still a bit of a science denier, that doesn't believe in the science of data, that, again, looks for reasons as to why it's wrong. And in fact, I had one colleague say, use the analogy that, I guess I'm the old school hockey coach that doesn't want to, believe in the analytics. I need to see performance on the ice to demonstrate whether something's working. So we're still in this environment where if you can't see it, touch it, or provide direct observation of something, the data must be wrong. And I think until we get to a point where there's more of an understanding of what the science is behind data science and how it can be used and how it can be trusted, and look at the methodology as opposed to all the reasons why this must be incorrect, we're still going to have challenges in the use of the data in terms of making decisions, certainly in a real-time basis, which is where we need to get to. After the fact sort of analysis of what could have worked or should have worked is great, but it's not in the vein of where we need to be in terms of data science being one of the primary real-time drivers of making decisions as opposed to the after-the-fact stuff.
Thank you very much, Deputy Minister Sinclair. Joe, I'm going to give you just a couple of minutes to respond to the question about what you see as the future of data science, of analytics and the integration of analytics. What needs to happen in the near future, and then we will put aside some time for the audience members to ask questions of our speakers.
Perfect. Thank you, Anna. I think that both Minister Sinclair and Victoria spoke on some really great points that I think are some of the keys to it. And one of them that came up in both of your discussions on this point is the idea of how you present data and how you present that information. And one of the things I talked to Anna about previously, we were talking about how you build a data science team and what are the key pieces to that. One of the key pieces that I found has given us more success than anything else was hiring a data visualizer as my second hire. So after hiring a data scientist that can get into the numbers and actually pull out a result, you need to have someone there that can present that to the executive, to a minister, to a member of parliament, someone who's not necessarily going to understand the numbers as just seeing them on a page. They're not going to look at a spreadsheet and come to a conclusion from that. They'll want to present it to them. And most of us have done that presentation piece in our past at some point, but we're not as good at that as someone who has an actual graphic design background that can really think about how do you take this data and really visualize it in a stunning way that makes someone look at it and pause for a second and go, there is something happening here. And really getting that presentment down to an art form more so than it is today, I think really would help in progressing the use of data within all kinds of different applications, both in public and private sector. I think another point is around education. So this has kind of come up slightly through what Victoria was saying earlier around how do you inform the public, and we have things like science deniers out there. What do we do to change that and shape that? And I think a lot of it has to do with how we educate the public and how we talk about these things in a public perspective. We need to take information and present it so that the average person can understand some of that information and can understand why we're using information to make a decision. If we don't have that understanding of A leads to B, the public often gets disconnected from this and thinks we're wasting taxpayer dollars, thinks we're throwing things away for no reason. We see it in private sector too. When we come to a company and we present them with information, if it doesn't drive a return on their investment, they're not going to like the information they see. And I think you have to have that same mindset with the public of, if this isn't driving something that's beneficial to people that we can show the benefit, they're not going to accept that fact you're presenting them. And it's really about how you educate and you inform. I think some cities have done a really good job with this, with building things like open data networks, where the data becomes a public asset, not just an asset of the government, but a truly public asset where others can access it, look at it, and build informed decisions from it. But I think we need to take that a step further and look at things like private-public infrastructure. So how we make interactions between private data sets that aren't owned by the public and public data sets to allow the public to actually view this information and look at it in a different context. I think one of the things we find that's challenging is finding the right talent to work with data. I think I've heard that across everyone. We have very talented people. But it's difficult to get the right people on the right projects at the right times. And one way to do that is to put some of this stuff in the public domain, where people who have a general interest in a problem might start building models, developing things, and ultimately collaborating with either academic partners or the government themselves on solving some of the problems that we have and some of the problems we face. So really in that 5 to 10 year horizon, I think building more robust open data platforms, better education of the public, and working on better visualizing our results and building out information in a way that can be understood by the general public will really result in the best outcomes for everyone in making more informed policy decisions.
So thank you very much enormously to all of our speakers. I think, through this conversation, you have highlighted some, really key, critical, overarching themes, around capacity, communication, interrelationship and connections across sectors. I wanted to engage with some of the questions being asked by the audience members. They fall across some, really interesting themes that we've already pinged on here. One of which is we're getting questions from, potentially researchers who are engaged in the academic community, asking, what can academics do? What kind of communication can they engage with to make sure that the findings coming out of, natural sciences, or the specific question is about ocean levels. What can academics do in order to communicate more clearly, both with government and with the private sector, in order to build those interconnections and those relationships?
I think if no one else could jump in, I can give a start to it and let someone top up. I think one of the big things is about presenting information at different levels. So a technical academic paper, not everyone's going to read. Very few people outside the field are going to read it. But being able to take those results and present them in a way that people who might have an interest in that information can understand and comprehend what information is provided there. And even going to another more general level of something that's of public interest, and taking that and showing it at different levels and different contexts, the information might become less and less detailed as you move it up that kind of chain of information, but it becomes more relevant to more and more people. And I think presenting academic information in different contexts than just in journals helps the general public as well as decision makers understand better what's out there and what's available to them. So I've seen that done. The University of Toronto is the University of Toronto Transportation Research Institute. I've seen them quite successfully present information on how Ontarians get around using public transit, where they had produced academic journals detailing the methodologies for collecting the data, how they build that information, and how the data set ultimately presented. But then they also produced a general white paper that kind of talked to, this is how Ontarians are getting around. It was kind of a statistical analysis with nice big graphics showing different routes and different types of transit. And by doing that, they're allowing that information to be digested by different groups. And I think that's been a really successful use case of that I've seen, that I think would be helpful for a lot of other academics if they can present data in different layers and different views. It could help policymakers understand better what's out there.
Yeah, if I could just add to that, it's a really interesting sort of fine line that we're walking on this. And, I spent a fair bit talking about, reinforcing Joe's comments about visualization and presenting information that's easily accessible by the public or decision makers or others. But if you don't have the sort of the academic piece behind it, which describes how it was done, giving that level of confidence in the science that it isn't just, made up numbers or, the notion of lies, damn lies, and statistics that people say that you can make them say whatever they want. It's this, you got to make sure that the rigor is there and that the science is there and that people have confidence in the science so they can accept it, but then yet present that in a way that's easily consumable. And I think that's the challenge that we've been struggling with in Manitoba, is striking that balance and giving people the level of confidence that this is real, but yet it's also accessible. Because those same people that want to understand the science or sort of understand the science, don't have the technical skills to consume that academic piece around that. So it still just appears to them like, some sort of black magic in the background. So it is this really challenging intersection of providing access, hyper access to lots and lots of people, trying to get this out, but yet having a population, I don't mean the general population, the population that I deal with, which are decision makers, really trusting it, having confidence in it, and believing in it. And I don't know what the answer to that is yet, but it's the real challenge that we're dealing with, is convincing people that it's correct, that it's real, that you can have confidence in it, without inundating them and overwhelming them with the science. Other scientific disciplines are, I think, doing a better job of it, where maybe it's just history and they've been around longer. But I use this example with Anna. We were having a conversation the other day about challenges with some of the work that we're doing. Nobody questions anymore that when you throw the apple up in the air, it's going to fall to the ground. But yet people still want to see the apple fall to the ground when it comes to data science. And I think a lot of the private sector use, and we see it in the media a lot about, people talking about algorithms on Facebook or Twitter or whatever it is that's pushing information. I think that that's not helping us use this with the general public and within government, because it's always seen as being misused as opposed to being appropriately used. There's not only is there the complexity of it and the lack of experience with it and the history of it, but there's also a negative narrative that's being associated with out there as well that we have to push up against.
I think I definitely agree with Scott and Joe's comments, and I would say if you have an opportunity in your presentation, sometimes you don't have very many minutes to be with someone, but we encourage researchers who are presenting research findings at the Ministry of Health to lay the context and basically to say, this research that we're doing sits on this body. And that really helps. I mean, obviously you can't in a few minutes summarize everything that's been done in that field, but it's really important that individual studies, like, people need some context. So so what we do know, like the literature in this area has demonstrated really clearly A and B. So what this study is doing, it's expanding our understanding by telling us this. Now, you may be aware that there were some studies with conflicting blah, 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 blah. I mean, you don't want to take them down a rabbit hole, but you need to be prepared to give some context to a research study so people understand, well, how does this relate to that other thing that I read in the newspaper that said something sort of different? And so I think that's critically important. And then the other thing I would say, depending on who your audience is, if you're trying to convince a community, or you're not convinced, but provide the information, again, I would consider finding out from the people who you're going to be talking about, what's the kind of evidence that they actually need to make decisions. And if you are providing 2 parts of their 4-part requirement, that's fine. You can't necessarily retrofit your research study, but it's really helpful going into it. And even the comment, some of the contextualizing you can provide can be helpful.
Thank you very much. So we have just about 10 minutes to speak quickly, hopefully to another question. So we're getting, a couple of questions here about, the different approaches, both from a technical point of view and from like a research methodology development point of view, being developed across different sectors. One part of it is, as Deputy Minister Sinclair was saying, we're walking a really thin tightrope between, creating evidence that's robust and rigorous and supported by, best practices in academia, and also things that are quick turnaround that actually meet government's decision-making timeline. And there are, increasing and growing types of analytic approaches that can be used for this, machine learning, processes that can take massive amounts of data to create insights. So I would ask our speakers to comment, how has new technology in your sector either facilitated some of the things that, we would like to see, or potentially have there been barriers?
Maybe I'll do a quick start on this. So technology is one of the areas that we are looking at. Machine learning, artificial intelligence, building robust real-time data repositories or data lakes. I think that the challenge that we're having with that is, and I can't remember if it was Victoria or Joe that made the comment about it. We're still at this intersection of proving out what's the ROI. I think Joe was talking about the ROI in that particular private sector councils. What is the ROI on this? We have a sense that all of those technologies can make a huge contribution to advancing the use of data and data science in the public sector, but we're still trying to prove out the use case and where is the ROI. So before we start investing in, implementing AI, machine learning, building data lakes, providing access at some scale for data scientists across the public sector to access this, we have to prove to governments that this is actually going to make a difference. The investment in those, at least in Manitoba, in a medium-sized Canadian jurisdiction, the outlay to invest in those kinds of things isn't going to happen until we can demonstrate and prove to government that there is the ROI there for taxpayers' dollars. Otherwise, it's going to be seen as, another academic exercise to explore and learn and all those kinds, which is incredibly important, but not the germane of the public sector right now, which is trying to, operate government and provide services in a cost-effective manner, all of which has been put on under the microscope with COVID-19 and declining revenue streams and increasing deficits. Is this the time for me to go and ask for a bunch of money to build a data lake and some artificial intelligence, machine learning to do this? So yes, it's on the horizon. Yes, we're experimenting at the margin, but we still have to get at that underlying business case as to why data science supports government, has an ROI, and how can it be used to help government bend cost curves and provide better services.
I don't really have anything to add. I thought Scott captured it well.
Yeah, I think, Scott, you've hit it right on the head there. It's really about how do you ensure that you're providing that value and how do you show that value to your stakeholders. And that's a very difficult thing to do. And it's not something, even in the private sector, where we can kind of tie it all back to money, dollars in, dollars out. Even then, it can be very difficult to show some of those long-term investments having that capability reward. We had a challenge when we first started out. We were using all internal servers, internal data lakes. And we were trying to make a case to move to cloud infrastructure, and even that was incredibly difficult. The dollars were there, but the part of the challenge was the benefit was in the speed we were delivering. So we could go 100 times faster by going to the cloud. But quantifying what that 100 times faster gives you is not simple, because it's not, I can use 1/100th of the manpower that I could use prior to that. It becomes, there is some benefit in terms of the number of people I need on my team, but it also is an expansion of what we can do. And that whole theoretical what's in the future is very hard to quantify in a way that people will agree with without seeing the number ahead of time.
Thank you very very much. We have time for a couple more questions here. So we have a question here about the misuse of science and evidence. So we discussed quickly how, the reader's biases or preconceived notions can kind of, highlight some findings while not highlight other findings, and make that person paint on specific issues that they see or maybe don't see in the data. So maybe if our speakers can speak to, how do we prevent the misuse of data, especially when that data is being implemented in policy, to have effects on people's lives.
So I think there's a couple things that I see immediately. One is that you've got to understand the difference between reactionary policy, so things like what's happening right now with COVID, so things that need to happen at a high pace. We can't wait 4 years to make a decision on what to do when there's an outbreak of a disease happening. So those reactionary policies are going to need a different process than your kind of long-term policy or your traditional government policy towards how you build that science. I think in terms of how you ensure that the right evidence is being used, it often takes having building the right group of people or the right groups and boards to look at what's happening. So I think things like ethics review boards are critical. As we move to more and more machine learning type of approaches to solving problems, explainability becomes a critical issue. A lot of machine learning is not explainable. It's, hey, the numbers work. But the challenge is if the inputs for that algorithm at the very, very beginning of it have biases in them, those biases are going to come through that algorithm, and we may not be aware of it. There's a really interesting paper, and I wish I had the author of it on hand, on the biases within photography, in that a lot of photographic equipment was built around European-centric faces and European-centric looks. So the light it captures and the way it captures light is focused on how white people's skin is. And therefore, when you look at any data set, that even if it includes every race and every creative person in that data set that's training the algorithm, there's an inherent bias in the actual equipment that captured the people to have better feature detection on a subset of those people. And there's things like that that I don't think are commonly understood by the people implementing these algorithms or by the people making the decision at the end. So I think it's also an education piece about how do we educate people from end to end on how these algorithms work, how things are working, and how we're making a decision based on that. Because if we can't explain that as the person making the policy decision, we shouldn't be making that decision. So I think it's really about explainability, about setting up the right constraints, but also setting them up in different contexts between things that need to be made immediately and decisions that can kind of take that time to build out peer review and build out everything else that academia traditionally does to ensure quality of data.
The other thing that I would add to that is that a lot of decisions that get made in government, evidence and data are a really important input, but they're not the sole input, and values and other things inform it. And you can look at things like small hospitals, that there have been historically different moves, different ways. Sometimes small hospitals have been closed because unless you maintain a certain volume of services and then it's basically not safe to do certain kinds of procedures unless you have a certain population and the physicians or the, actually encounter them. You don't want a neurologist to do brain surgery if he or she only does it 3 times a year, kind of thing. But when you think about, so there's safety and there's real issues and the data does not support certain, but if you think about that, what is the function of some of those hospitals in semi-rural areas, not remote, in rural areas. And if you think about things like Indigenous reconciliation and how those services are used and what are some of the difficulties that are encountered with providers, and I assume that machine learning and AI could actually integrate a whole bunch of different factors, not solely just procedures and safety levels. But I think that there are other considerations in terms of the health and viability of a community that also need to be considered. And so I'd say we moved away from evidence-based decision-making to evidence-informed decision-making in recognition of the role that values and other considerations also play. I'd add that. Which is not about misinformation, I hope. That's just about other considerations.
Yeah, I don't have anything other. I think Victoria and Joe covered it quite well. I think it's about transparency, explainability, which is, I think, what we've been talking about ever since I got on the call. And how do we do that? And it's easier said than done. I think that's the big challenge that we have. And then, as Victoria was saying, we've shifted away from evidence-based to evidence-informed or evidence-influenced on that front, recognizing that there, at least in the public sector policy sphere, there are a whole bunch of other factors that go into decisions, and data science and data-driven evidence is only a portion of that.
Okay, thank you very much to all of our speakers. Unfortunately, that concludes the amount of time that we have for questions, but I do see in the question dialog box some specific inquiries to our individual speakers, and I invite our participants to reach out to our speakers individually to pose them, or to me if you would like me to connect you to any of them. So thank you all again very much. I really appreciate your time. I think this has been an absolutely informative conversation on, a pressing issue. And I invite you to continue the discussion either over email or through the various forums available through the Canadian Science Policy Conference. Thank you all.
Thanks, Anna.